Yang Chen. I'm gonna handle the IVPB back for the nursing 130 class. Okay, so I got on my medication in the Pixies. Also, I did my first and the secondary check in the Pixies and the preparation room. Now I'm going to do the third medication check at the patient's bedside. So the medication I got is cefazolin, 2 grams in 100 milliliter, and the rate is 100 milliliter in 1 hour. So after that, I'm going to do the hand hygiene, wear the gloves, check the patient. So first I will verify the patient by her name and the MRN. Also, I will check the patient's ID set here to see whether any is edema, infiltration, whether there's any redness around this area. Also, I will ask the patient whether is there any pain during this around this area. Also, I will ask the patients whether is any allergy to cefazolin or any antibiotic. So after I check all these, patient is good. Also, I was planning to tell the patient why he needs to use the antibiotic and what the side effect for this medication will be. So after all that, let me go grab a new gloves here. After all this, I'll go ahead and hand hygiene again. Okay, so wear the gloves. Touching the top. Also, go ahead to pick into the back. Here, I need to make sure this tubing is clamped before I hand it here. So this one is closed. I go ahead and hand it here. Get it ready. Then I will pass the primary back. After this, get an unclosed swab. Here, get the secondary ready. Go ahead and move the secondary cap. Connect this two. Then I will do the back priming here. Make sure there's no air bubble. I will open the clamp, and that's the primary workflow here. Okay, now it's all bubble free. I'll go ahead and hand here and use this one. Go ahead and lower the primary back. After all these, I'm going to program the secondary back. Go to channel selection first, then secondary, then choose the medication, which is cefazolin. Then the medication is 2 grams in 100 ml. So confirm here, go to the next, set up the rate volume here. The rate volume is 100 milliliter in 1 hour. So in this case, this medication will run about 1 hour and the dosage is 2 milligrams. After I check all these, double check the tubing again. Okay, it's connected to the patient, so we'll go ahead and start it. After I started, I will wait for the first drop of the medication.
I mean, when I did that, I did this first.
While I was waiting, I'll go ahead and label the back here and label the tubing. The tubing will good for 96 hours. For this one, I will put the data time my initial, and here I'll put the data time I set up the tubing here. Then I will take off my gloves, do the hand hygiene, document the medication, and check back on the patient probably in 10 or 30 minutes. Because the rate is very low, so it might take a while to see the first drop here. Okay, so here we go.